So I'm Katie Masters. I've actually been a dentist now for about 10 years. I work with Aspen Dental. So I've got a really good surgical background as far as doing extractions and that kind of thing. But I just have never placed implants at this point in before coming here. This class was completely different than what I expected. Coming in, honestly, I just wasn't sure what to expect. So it was just completely kind of blew my mind, honestly. I came in thinking it would just be surgical, kind of hands-on implants, which it was. But then we got a lot of other information on how to present these cases, how to get your patients to buy into the importance of this type of treatment. So honestly, it was just a lot more informative and educational than I thought it was going to be. I have placed 19 implants right now, but I still have an afternoon to go, so I should be at 20 by the end of the day. As far as the topics that we discussed in the class, obviously there were a lot of them, and surgical is always most important, but really what drove home to me was the presenting this to my patients. I've just never thought about it the way they describe it, and the importance in getting your patient to buy into the treatment, because we know it's best, but we've got to convince them that it's the best for them. So the way they discussed that and presented it, it really was what I'm taking home from this course. From what I've learned here, I definitely feel like I can go right back to my practice and start placing implants. I'm confident in my skills, and honestly, I'm excited and ready to go back and do it. The atmosphere at the Institute has been amazing. You know, you always, when you come somewhere and you don't know anyone that you're coming with, you're a little nervous about it. Is it gonna be fun? Is it gonna be really tense? But they make the atmosphere a lot of fun while still being super educational. I've enjoyed every minute of it, honestly. I definitely would recommend this course to my colleagues. I know a lot of other dentists that have taken implant courses and they leave feeling okay, but not really confident to go home and start the process. And I just don't doubt that here, so I definitely would encourage it to anyone.